Are you in a cold war? If you've been attacked by the common cold, there are ways to fight back. Dr. Paul Kaleta has joined us in the UH Broadcast Center with winning strategies for feeling better. Dr. Kaleta is in internal medicine at University Hospital, so welcome to our show here today.
Thank you for having me.
Now, everybody gets a cold now and then. Is it really that big a deal?
Well, the average adult's going to get about 2 to 3 bouts of a cold per year. Children, and I'm not a pediatrician, but a little more frequently. And most often it's really not a big deal. It's a pretty benign self-limited illness. But you know, there's a lot that we can do in terms of symptom relief and practicing good hygiene and different things to try to prevent transmission and especially retransmission. Sometimes you get the cold in the house and people keep passing
it back and forth.
But there are certainly some more bigger red flag type symptoms, and sometimes it's more of a self-limited illness, but other people it can be a little bit more serious.
Okay, so when we're talking about those symptoms and things, is your cold the same as my cold? Are we going to have the same kind of symptoms?
Well, there's always the what's going around kind of thing, and so some people will come into the office and explain that, oh, I've had the runny nose or the dry cough, and you see some trends in those kinds of things, but there's literally hundreds of different viruses that we consider the common cold, and each of those do have slight variance, but the common symptoms that you're going to see are predominantly the runny nose. You're going to see a lot of the congestion type symptoms, and then a lot of the manifestations of those things. So you hear about the post-nasal drip, or as we lay down to sleep at night, you get that drippiness in the back of the throat. You can get some scratchy throat, some fullness, and a little bit of a dry cough as well.
Okay. Now we know that there's actually no cure for a common cold, but when is it time to go see the doctor?
Yeah, there really is no evidence that shows that there's a cure, but the average cold is going to be anywhere from 3 days to 10 days, and potentially even a little longer. For healthy adults, that's an adequate amount of time we expect the symptoms to come and go. But when the symptoms persist, when it's been beyond 10 days, there might be something else going on. And that's certainly a good time that we expect to see people in the office. And then also people who have other underlying conditions, underlying heart, lung, liver disease, any kind of organ dysfunction, they should be on more high alert, because even just a cold is something that can be potentially more serious. And they should be in contact with the doctor even at the onset of
right
symptoms.
Away, huh? Okay. And it is just a cold, but you can feel pretty darn miserable. So are there suggestions for helping people feel better?
Yes, and I did forget to mention things, by the way, like fever or like a productive cough and other things that would prompt more quick attention. But
okay.
The things that can make you feel better, I think first and foremost is practice good hygiene. You have to wash your hands. You have to, anytime that you've blown your nose, wash your hands. Hygiene is an important part of stopping the transmission to other people, retransmission. And I think I would always joke with patients about the vampire sneeze or cough and keeping those kinds of things contained. So I think hygiene is paramount. But in terms of the treatment, it's symptom relief. And so there's various kinds of nasal sprays that you'll see in stores that are, some of which are actually particularly effective. Afrin, for example, is particularly effective. I do caution patients, though, there can be a rebound effect after stopping it. So using it for too long, beyond 48 to 72 hours, can really put the higher chances of rebound. So Afrin's effective, but usually in just the first day. Nasal saline, which is not really a medicine, but can help to wash out the sinuses and to help control your symptoms. Actually, runny nose itself is more a manifestation of your immune system trying to get rid of a cold rather than the cold itself. And so it's the same kind of thing, trying to wash that stuff out. And then things like zinc and vitamin C, we have a lot of patients ask about these types of medicines. There's not a lot of evidence to support their use and whether or not they're actually effective. But my opinion is I've known several other physicians that do recommend these things. I don't think they do any harm. And so I think that's something to try. And one of the last things is a nasal decongestant. So a pill like pseudoephedrine, it's very effective. But one of the things, if you have any other underlying conditions, probably a better idea to check with the doctor first before taking it.
All right, great tips for us here today. Win your cold war by following Dr. Coletta's advice. His tips will make your symptoms surrender. My thanks to Dr. Coletta for arming us with such great information.
Thank you.
For more information, call the Center for Lifelong Health at University Hospitals at 844-312-LIFE. That's 5433. Or visit www.uhhospitals.org/lifelonghealth.